Hi, my name is Dr. Sivan Hilo. I'm the head of male infertility at the Mayo Clinic in Rochester, Minnesota. In this Mayo Clinic Men's Health Moment, I'll discuss post-vasectomy pain syndrome. I hope that you'll find this video useful. Every year, about 500,000 vasectomies are performed in the United States. An estimated 1 to 2% of those patients will go on to develop chronic testicular pain, often referred to as post-vasectomy pain syndrome. This is likely an underestimate, as a lot of patients may not report that pain to their doctor. Post-vasectomy pain syndrome is defined as pain that lasts longer than 3 months after vasectomy. It can vary from an occasional discomfort to daily debilitating pain. The cause is uncertain. Some theories as to why this may happen include a compression of the nerve to the testicle, back pressure from the blockage of sperm not being able to advance, and it may be due to an immune response. Symptoms of post-vasectomy pain syndrome are pain that wasn't present prior to and that never resolves after your vasectomy. It can vary from a sharp to dull pain that radiates to the testicle or groin area. Some men describe it as pain with ejaculation, intercourse, or when they get an erection. And some men are able to pinpoint their pain at the site of where the vasectomy was performed. Lastly, some men describe a feeling of fullness or pressure in the testicle or right above the testicle in an area called the epididymis, which is where all your sperm are stored. They're made in the testicle, but then stored in this area in the epididymis until they're ejaculated. It's very important to rule out any other causes of pain, which can include infection, compression of nerves in the lower back area due to a herniated disc, a hernia, and pelvic floor dysfunction, prior to considering any surgery for post-vasectomy pain. There are several non-surgical treatments for post-vasectomy pain, and we typically would encourage patients to try at least one of these treatments before considering surgery. First, non-steroidal anti-inflammatory drugs, or NSAIDs, for a period of at least 4 to 6 weeks. These are medications like ibuprofen, meloxicam, and naproxen. Next, tricyclic antidepressants, or a medication called gabapentin. Examples of some tricyclic antidepressants include amitriptyline and clomipramine. These types of medications have been shown to help with nerve pain or neuropathic pain. Next, pelvic floor physical therapy, which may benefit some men who have symptoms that extend beyond the typical post-vasectomy pain symptoms, that extend to other areas of their pelvic floor. And lastly, acupuncture. Although there's not strong evidence that acupuncture is effective for treating this pain, it has very little risk and potentially may improve a patient's symptoms. There are several surgical treatments for post-vasectomy pain. We'll discuss each of the following in a little bit more detail. Those treatments include excision of sperm granuloma, which typically is recommended for patients who present with pain at the granuloma site on exam. They can pinpoint that pain to the specific area where their vasectomy is performed. Next, microdenervation of the spermatic cord, which is essentially stripping the nerve that goes to the testicle to help with pain. This type of pain will typically resolve with patients who get a temporary nerve block. Next, epididymectomy. Remember, the epididymis is that structure where all the sperm are stored above the testicle. Patients who have pain that localizes to that area may benefit from epidydymectomy. Then there's vasectomy reversal. This is a good option for patients who are not concerned about future fertility, and also helpful for patients who describe feeling pressure or congestion, especially with ejaculation. Lastly, orchiectomy. This is surgical removal of the entire testicle. This is absolutely a last resort if all the other treatments fail, because once the testicle's gone, you'll no longer have that sperm production and, more importantly, testosterone production. And patients may still continue to have pain even after the testicle's removed. It's sort of like a phantom limb pain. So first we'll talk about excision of sperm granuloma. So a granuloma is a small mass that can form at the vasectomy site. It's non-cancerous, but it's due to sperm leaking out of the cut end of the vas deferens, that tube that gets cut during vasectomy. To remove this granuloma, it's a 20-minute office procedure. We use numbing medication so that you won't feel any pain, although you may feel some pressure. Risks of this procedure include persistent pain, bruising or swelling of the scrotum that can take days or weeks to resolve, and a wound infection that may require antibiotics. Risks are typically rare with this procedure, and if the pain doesn't resolve, you can go on to have any of the other surgical treatments that we'll discuss. Microdenervation of the spermatic cord. Now, this is a surgical procedure that's done to strip the nerves and the veins that go to the testicle. To see if you're a candidate for this procedure, your surgeon will perform a cord block in the office. They'll use numbing medication directly into the area of that nerve and see if your pain resolves. If it does, it typically will go away for a few hours or a day or so. If you choose to have this surgery done, it's a 60-minute procedure. It's performed either in the office or in the operating room with an operating microscope. Success rates range from 70 to 96% depending on how each of the different studies have defined success, but the vast majority of patients will describe a significant improvement in their pain, although it may not completely resolve the pain. Risks of this procedure include persistent or worsening pain, a hydrocele, which is a fluid collection around the testicle. This rarely requires an additional procedure or treatment unless it's causing a lot of pressure or discomfort. And lastly, a decrease in the size of the testicle due to an effect on the blood supply. If this happens, the testicle will typically shrink over time and stop producing sperm and or testosterone. If the pain doesn't resolve with this surgery, you cannot choose to undergo a vasectomy reversal in the future because the blood supply to that area will be very poor. Epididymectomy. This is a procedure that's done to remove the entire epididymis, which is where all those sperm are stored after they're made in the testicle. It's a 60-minute office procedure. Can also be performed in the operating room for patients who are anxious. If it's performed in the office, we use a long-acting numbing medication as well as medication to help relax you. Success rates for this procedure are around 90%. Again, this is a better procedure for men who have pain that pinpoints to the epididymis or a feeling of fullness, especially with ejaculation. Risks of this procedure include persistent or worsening pain, a hydrocele, which is a collection of fluid around the testicle, infection either of the testicle itself or of the wound, and a decrease in size of the testicle due to an effect on the blood supply. This is quite rare with this kind of procedure. If your pain does not resolve with this procedure, you also cannot undergo vasectomy reversal because the vas deferens, the tube that we would be reconnecting, is attached to the epididymis. Next, microsurgical vasectomy reversal. This is a surgical procedure done to restore the connection between both ends of the vas deferens, that tube that was cut during your initial vasectomy. It's typically a 2 to 3 hour procedure. It's performed in the office or in the operating room with an operating microscope. Success rates vary from 70 to 100%, and risks of the procedure are similar to the other procedures we've described. It includes persistent or worsening pain or infection. Keep in mind that if this procedure is done, potentially you will have a restoration of sperm to the ejaculate, so you'll need to use an alternative form of birth control. You can still undergo any of the other procedures described if your pain persists. Now, typically, insurance will not cover a vasectomy reversal that's done for fertility, but they may cover a vasectomy reversal that's done for post-vasectomy pain syndrome. So you'll have to check this with your individual insurance provider. Lastly, orchiectomy, which is removal of the entire testicle. This is an absolute last resort if all the other treatments have failed. Your other testicle should produce the correct amount of testosterone to make up for the testicle that will be removed, but this is not always the case. And risks of this procedure include persistent pain despite removing the entire testicle. Some patients will have a sort of phantom limb pain, so to speak, that may continue even after surgery. And you may have low testosterone if the other testicle is not producing a normal amount of testosterone. Thank you so much for watching this Mayo Clinic Men's Health Moment on post-vasectomy pain syndrome. I hope that you found this video useful. If you'd like to make an appointment to be seen for this condition, please call the number provided on your screen or go to mayoclinic.org. Thank you so much for watching.